This is Wiki Verma and Dr. Tietz, David Russell, here for the Petaluma 360. What we're here to discuss today is the epidemic of prescription drug abuse, the effect of it in our community, our body, society, etc. Thank you, gentlemen, both for being here.
You're welcome.
Prescription drug abuse. We have the point of view of an ER doctor and acupuncturist. Dr. Tietz, why don't you tell us a little bit about yourself, your experience as a doctor, and some of the things that you've seen regarding prescription drugs, drug abuse, and their effects.
Well, I've been a doctor for almost 30 years and the emergency room doctor for about 27 years. And during the course of my career, which expands, obviously over 2 decades, I've seen a change in attitudes of physicians about pain, chronic pain. So in the beginning, there were very few doctors who believed in chronic pain, and if anything, emergency physicians and physicians in general undertreated pain. And as a reaction to that, we've come full spectrum. Now we treat pain, and which is appropriate, and we should treat pain, and we treat chronic pain, but the spectrum is swung to the other end, whereby we're seeing many, many more cases of prescription drug abuse and the side effects of prescription drug abuse. For example, in 1997, there were about 15,000 deaths from prescription drug abuse.
Wow.
In 2008, 28,000 deaths.
Wow.
Now, the difference, and these are unintentional, these aren't people who are taking it as an overdose. These are people who are taking the medications as prescribed and they end up dying, and it's an epidemic. And the CDC understands this, and that's why they're trying to promote programs to address the problem. And the problem is huge, as you can be aware.
And David Russell, why don't you tell us a little bit about yourself, your experience, and what your thoughts are on prescription drugs?
Okay. Well, I've been an acupuncturist for 5 years, and patients who tend to come see acupuncturists are looking normally for an alternative to, the typical routes to deal with pain. Pain is the biggie that they deal with often, and so I see lots of patients who have been addicted to painkillers in the past, and then they still have the pain, so they need another way to deal with it. I've seen patients who can't deal with the side effects. They can't go through their day loopy on Vicodin, so they can't drive, they can't do their normal jobs, they can't take care of their family, so they're looking for also alternatives. And so it brought me to think of ways how I can help out other than just doing acupuncture, and I came across the DEA's program, the Drug Take-Back program.
Drug Take-Back program.
Drug Take-Back program is a program created by the Drug Enforcement Administration that is a simple and safe way for people in the community to get rid of prescription drugs that are either unwanted or expired, because instead of having them in their medicine chest and having these addictive controlled substances that maybe they're struggling with, or that way they could get rid of them and safely dispose of them. It's a way to help prevent drug abuse in one way, but it's also a way to just spread the awareness of the epidemic that's really going on. Sometimes I think that's even the more important aspect of it.
And prescription drugs, we're using the word epidemic, problem. Not all drugs are bad, are they, doctor?
Any drug has side effects, including something as simple as aspirin and Tylenol. And the problem is, you're right, but you're not right. And any drug can be dangerous. And what we've done is gone from using prescription drugs in a very limited fashion to using it on many patients, and using extended action drugs, which are the most addicting of all, to the point where these patients are inadvertently taking enough narcotic to stop breathing, or aspirin.
Action drug. What is an action drug?
Well, it would take, for example, normally, like if you were to take a Vicodin, for example, it would take 4 to 6 hours. It lasts about 4 to 6 hours. If you were to use OxyContin, on the other hand, or methadone, or fentanyl patch, it could last anywhere from 12 hours to days.
Wow.
And sometimes people cut it open, like with the fentanyl patch, I've seen that, and that destroys the extended spectrum. So instead of getting a little bit, extended hours, getting a little bit of the drug at once, all of it comes in the system and they
Wow.
stop breathing and boom. So it's an issue that, and I mean, the problem with prescription drugs, there's several problems. One is the inadvertent overdose. Two is the intentional misuse. About 30% of Americans in a recent who are taking prescription drugs, of the 100 million Americans who have taken it, admit to non-medical use of prescription drugs. That's a huge number of people. That's like 30 million people. And the other problem is that most of these drugs are coupled with Tylenol or acetaminophen. Chronic Tylenol use has, from pain medications, has become the #1 cause of liver transplantation in this country. It's exceeded hepatitis C.
Wow.
So,
and that's Tylenol.
That's Tylenol, because Vicodin, Norco, Lortab, they're all attached to Tylenol. So, so these drugs, that's another whole issue of in terms of chronic liver damage from these medications as well.
And when you look at some of these prescription drugs, their effects, how does it, I understand sometimes when people take prescription drugs or any drugs the wrong way, it can almost double do the work a doctor needs to do. So how have you noticed, David, how prescription drugs have maybe made your work a little bit harder?
Well, all those painkillers, they affect the brain chemistry in a way too, where the patient's perception of pain changes after a long period of time. So you're dealing with not only I mean, pain is a complicated thing. It's not just simple, ouch, it hurts, and the level's the same for everybody. Everybody's different level is completely changed. So when I have these patients who have taken painkillers for so many years, it's just you're dealing with so many more factors than the straight pain. You know, that's why you really need a team of, you know, sometimes they need some psychotherapy to deal with it or other modalities combined. So that's one of the things. But you know, oftentimes I'll deal also with people, they, instead of painkillers, maybe they'll get back surgery that is unsuccessful, and then you're dealing with, you know, the unsuccessful back surgery and then the painkillers on top of that, and it just gets more complicated and harder to treat.
In your ER department, is prescription drugs an issue? Have you seen more complicated processes or procedures required because of some of the results of prescription drugs?
Absolutely. I think in the ER it is a problem on several levels. One, the prescription drugs alter your pain, as David said, alter your pain reception. There is a mechanism called tolerance, in which you require more drug to achieve the same effect. Then there's a question of addiction, in which you actually need the drug in order to, you know, you crave it. And there's a problem that it changes the pain receptors, so that you require more. So what it has done in the emergency room, #1, that it is more labor intensive, so that the patients that we see with chronic pain require more time, more effort, because we have to make sure that we're doing the right thing. And the right thing may be not to give them more pain medication, but you can't just go in and out. And as a result, we only have so much time, and as you know, we're a busy emergency room. We have to divide up our time among a lot of different types of patients. So it is time consuming, and it is often difficult to manage, because there are expectations of the patients, of emergency room physicians, that we may not be able to meet. In other words, we are not chronic pain specialists by any means at all. So as a result, for my personal practice, I do not give any extended length prescription drugs, period. I don't do it, no matter what. On the other hand, I will give certain medications like Vicodin, Norco, but there are strict rules which we need to apply. So all these things that you take time and pull me away from other patients.
I know what some children are doing, and as well as other people, is they'll share prescription drugs. Or if I have a headache and I have Vicodin, and somebody else has a headache, I was like, oh, here, take one of these. When people share these kind of controlled substances, that's basically what they are, they're controlled substances. What are some of the factors that go into a prescription?
Well, It's the nature of the disease. So was this an acute problem like a bone fracture? Was this a chronic problem like chronic back pain? What is the age of the patient? What are, younger patients may, obviously, who are smaller will need less medication. What is their prescription history? If they've been taking medication for a long time, they can tolerate more than somebody who is de novo starting the medication. What is the status of their liver? What is the status of their kidney? So for excretion mechanisms, you have to adjust doses based on certain medications. So a lot of complex decision making is taken when we give these pain medication prescriptions, and therefore, to get to the point, that should never ever be done.
Wow.
100% no.
And I hear a couple statistics out there talk about how children now have accessibility or prescription drugs or some of the things that they're using quite a bit of because of the accessibility of them. Right? Mm-hmm. And I think that's where the program that you're working on, David, really falls in place.
Right.
Tell us a little bit more about how the program you're working on is helping getting rid of these prescription drugs that are available to children and other people.
Okay. Well, just like you said, that is one of the main problems, is that there's these tempting drugs, you know, that have street value, and these high school students, teenagers, they'll see it in their parents' medicine chest, and you know, that's how, gosh, I read some statistic that, you know, 40–50% of kids nowadays, now they just go more towards those pills instead of, in the past, maybe it was marijuana, cocaine. You know, now prescription painkillers are the second most common drug used by people in the US. So if that's part of the drug take-back program, is that instead of having these pills that say you broke a bone, you used the Vicodin to the point that you needed it, then you have some left over, instead of leaving it there for maybe, you know, you have a headache one day, a really bad one, you want to use that. Instead of that, you can get rid of it safely, and then it won't be in the house. Your kids won't be tempted to take it, bring it to school, sell it. There's lots of that going on too. So, you know, it's easy to get. It's you know, it's legal to, if it's prescribed to you, it's legal, and so it's easier in some ways to get than going on the streets and trying to find a dealer for, you know, heroin, cocaine, any of that, you know. So in some ways it's a lot easier to get that way, and this way is a nice, safe place. Working with the local law enforcement, we'll have some drop-offs that ideally you know, is a daily thing, so when somebody needs to get rid of the med, they can just get rid of it that day.